Hi everyone, my name is Jacqueline Hoffman, and today I will be discussing with you the childhood malnutrition issue in Venezuela. In 2014, the economy in Venezuela began to collapse, but the increase in malnourished patients appears to have begun in 2016. Venezuela's collapsed economy has resulted in many citizens losing their jobs and an influx of death from childhood malnutrition. The government is in denial of the issue and are trying to conceal the existence of the problem within the nation. We will be discussing the issue using a social ecological model. In this slide, we will utilize the aspects that promotes and hinders public health using a social ecological model. The individual model, what promotes public health is knowledge, and what hinders it is attitude. Knowledge is a big part of public health. Educating the public on ways that can live a healthier lifestyle while also managing the resources that are available creates a healthier environment for everyone in the community. Families do not seek medical treatment for their children when necessary, which sometimes leads to catastrophic results. Some of the cases that were discussed in the study were children whose parents waited until their children were on the brink of death before seeking medical attention. If only they were seen by a doctor sooner, it's possible that some of these children will still be alive today. The interpersonal level, what promotes public health is provider, and what hinders it is family. Healthcare providers are useful resources in identifying the cases of illnesses in Venezuela and what is triggering the growing issue in the country. They are the ones that can assist with providing guidance on how to save the children that are dying. I believe that with the massive inflation going on in Venezuela, the lack of accessibility to healthcare and other resources is prompting families to lean on each other for more support. However, in the case of Esteban Granadillo, an 18-month-old baby, whose aunt was providing him anisette tea, chamomile water, and cow's milk, made him sicker and possibly damaged his organs. The child ended up dying. Despite of the good intentions brought on by the families, they can sometimes do more harm than good. In the organizational level, it promotes public health as community-based organizations, while what hinders it are state and local health departments. Community-based organizations are usually a great resource to help promote public health within the community. They're composed of stakeholders that provide highly valued resources to the community, including programs and services that can assist with dealing with the problem at hand that is most affecting the community. Many state and local agencies are not doing their jobs in assisting the communities with their needs. The lack of formulas and availability of healthcare is making the children even sicker and is increasing the number of fatalities due to malnutrition. In the community level, what promotes public health is survivorship support organizations and groups, and what hinders it is the media. Losing children through malnutrition can be extremely difficult for the parents and the entire family. Having survivorship support can help families deal with the problem at hand and learn how to cope with the losses while also managing their own health and the remaining family, such as their other children. Due to the denial of the government, the media is silenced and is not relying the information to the public on how severe the issue really is. The public is not being educated on what resources are available to them and what actions they can take to prevent further deaths in their families. Within the policy level, what promotes public health is national advocacy and nonprofit organizations, while what hinders it are federal government agencies. With the current status in Venezuela, I believe that they are lacking national advocacies and nonprofit organizations that are making an impact on malnutrition issue in the country. If properly implemented, they can have a massive impact in providing resources to women and families and fighting malnutrition of children in the nation. The federal government's refusal to obtain international aid is the biggest issue in terms of addressing the malnutrition problem in Venezuela. Denying that the problem exists doesn't create solution to the problem, but rather it only makes it worse. The evidence-based interventions that we will be utilizing are multiple micronutrient supplements during pregnancy, the Promise Project, and specially formulated foods for treating children with moderate acute malnutrition. These interventions relate directly to Venezuela, as they target hunger and childhood malnutrition in poorer countries. Providing micronutrient supplements during pregnancy in women in combination with protein supplements can easily be done in Venezuela to target the malnutrition in children. Accepting aid from organizations with the clear goal of fighting childhood hunger should be the number one priority of the nation. By utilizing the Promise Project, we can investigate the most affected areas and create preventative measures that are cost effective not only for the community, but to the nation as a whole. Utilizing community-based interventions will allow for an integrative solution to the problem before it exists and can be utilized to provide interventions efficiently. Specially formulated foods for treating children with moderate acute malnutrition can work if we first identify the type of formulated foods that can work in reducing hunger in low-income countries such as Venezuela. It'll be easier to make this intervention effective if we utilize the resources that already exist in the country. Once these foods have been identified, we can assist in creating food banks and programs that will distribute these foods to the most affected populations and educate the public on the importance of consuming the formulated foods and adequately provided to their children. We will be targeting the families that have children under 5 years of age. The program evaluations are process measures, impact measures, and outcome measures. For the process measures, we will be utilizing surveys, focus groups, and in-depth interviews. We can conduct community outreaches which discusses the interventions and provide the members of the community with the survey questions. We can utilize focus groups and in-depth interviews to reach out to the resources to conduct focus groups in Venezuela. We can gather a diverse group within the community that are most affected by malnutrition and have an open discussion on what preventative measures we can take to reduce death from malnutrition. We can also speak to families that had experienced death within their households and measure the well-being of the remaining children in the home. Once we have the data, we will conduct the interview in small groups with the parents and caregivers to assess if the program was implemented as needed. We will provide counseling as part of the intervention to ensure that families will not risk having the rest of their children removed from the home due to another death. We can provide additional resources to the group that have been identified with higher risk for acute malnutrition and track their progress closely through the duration of the program. The impact measure and outcome measure is the before and after study. We can track the group that was provided the intervention and conduct several follow-up visits to analyze any changes that they might have experienced since the implementation of the program. We will collect the children's weight, overall health, and the number of deaths and identify if there's been any changes directly related to the program. We will also work closely with hospitals and doctors to ensure that the number of admissions in children who are underweight has reduced as directly resulted from the program. The challenges and barriers that we encounter are non-involvement of government organizations and denial of the existence of the issue, lack of proper resources in communities and healthcare facilities, lack of education for mothers and alternative choices for nutritional supplement for their children, extreme poverty and continued downpour of the economy, lack of opportunities for parents in order to properly support their children. The solution to these barriers are communication with stakeholders, educate the government on how drastic the issue has become in their country, and encourage them to accept international aid to address the issue of hunger in Venezuela. Increase government involvement and provide international aid through organizations and programs, and educate the public on cost-effective intervention and encourage them to seek assistance and speak up when they need help. This slide discusses the logic model that I have created that has an impact to reduce childhood malnutrition rate in Venezuela. It addresses the inputs, activities, outputs, and outcomes in hopes that it can reduce the acute malnutrition rate. The final slide shows all the resources that I utilized in creating this presentation. Thank you so much for taking the time and watching my video. Goodbye.